Which opening does this nerve pass through? Gabby here from Med School Bootcamp, and in this image, we're looking at a dissection along the aspects of the nasal cavity. So we've taken a sagittal section of the human body, and we're looking right over here. We can see the nasal septum more anteriorly. So here's the nose. So here's going to be anterior. As we extend more posteriorly here, we can see that the rest of the bony nasal septum has been removed. The nasal septum as well as the nasal conchae have been removed to better see components of the nasal cavity. So right over here is going to be the right maxillary sinus. So now that we're oriented, let's have a look at this nerve that is traveling very deep inside the head. More specifically, this nerve is actually entering into the pterygopalatine fossa. And the pterygopalatine fossa sits even deeper than the infratemporal fossa. So we know that the infratemporal fossa sits deep inside the mandible, and then we have the PT fossa, which is found even deeper and is going to be a lot closer to the nasal cavity. So in this case, the nerve that runs through the PT fossa is going to be the maxillary nerve. And the maxillary nerve is going to give off the pterygopalatine ganglion, which we can see right over here. And the pterygopalatine ganglion will give off a few branches, including the pharyngeal branch, that will go and innervate specific aspects of the pharynx, which is all over here. We could also see two branches that are descending. So we have the greater palatine nerve, which will enter into the areas of the hard palate to go ahead and innervate it. We can also see the lesser palatine nerve, which travels adjacent to the greater palatine nerve, but instead goes to innervate aspects of the soft palate here. And then lastly, we can see along the area that pterygopalatine ganglion as well, we can see portions or the rest of the maxillary nerve as it's traveling within the pterygopalatine fossa. Now, the maxillary nerve or the maxillary division of the trigeminal nerve is considered one of the cranial nerves, so it originates from the brain and exits the skull to eventually enter into the PT fossa. But how does it get there? So specifically, the maxillary nerve is going to exit through a foramen that is found along the aspects of the sphenoid bone. And specifically, the maxillary nerve is going to exit at the level of the foramen rotundum. So in this case for our question, so which opening does the maxillary nerve pass through? The answer here should be foramen rotundum.